How are we doing today? I hope you're fine. Thank you. Edgar Jack D, you're welcome. Eddie Zico, you're welcome. Thank you very much for notifying me that. Thank you. I'll be lecturing on live today, so I want more viewers to join up before I start. I'm only seeing 6%. So let more persons join, then I'll proceed. So the main purpose of this life is to lecture on pregnancy. You might say you're a guy, you don't need to know, but you need to know either you're married or you're going to get married someday. So let's stay focused as we proceed with today's lecture. Before I start with the topic, I want to just say some things that is very vital. All right, health is very important. Health is very important. A person will tell you it's normal thing to say that health is important. It's normal, but how many persons are living healthy? How many persons can say I'm 50% or 90% healthy? It's rare to see people saying that because they are not sure of their health. Or remember that in order for you to be sure of your health, you have to go to the clinic, the hospital, or any special center that's like primary health care, all right, or any hospital that is being registered to run some tests or some checkup. So when you've done that, when you're instructed on what to do, then you go ahead with it. Many a times we have challenge because people tend not to listen to medical instructions or advices. So we see ourselves fully a victim of being sick or repeated sickness. You've treated something. Joanne, you're welcome. Joanne Smith, you're welcome. And what you've treated, thanks for the love, thank you. You keep repeating itself. The reason because you refuse to adhere to medical advice. All right. Want donation? Okay, you can. Joanne Smith, you can. Hi, you can. Thank you. All right. So basically today's topic is about pregnancy, but I'm just saying little thing about health because I'm just seeing few viewers today. I want more viewers to join. So when you have, thank you very much, Joanne Smith. When you have health challenges, what do? Well, some persons that are spiritual will tell you pray, but the truth is, when you have a challenges, you have to seek medical attention. All right, it's very essential. Seek medical attention, and when you seek medical attention, the prescription given, the treatment that's needed to be done, you ensure you follow it the way it should be. How much one? I didn't get you. I didn't get you. John Smith, I didn't get you. If you are donating, okay, I really didn't understand what you're saying. All right, let me just proceed. But if you want to make donation, you want to make me feel welcome, or you want to, I don't know what you want to do, but whatever you want to do, I don't want to get scammed. All right, if you get scammed, I don't understand. All right, please don't distract the lecture. Thank you. All right, so if you are sure of your health, you have to be very pretty sure. I know someone that have said, the truth has been told, there's no one that is 100% healthy. Some person will not want to believe me, because there are some health conditions that you might not know of because you've not run some tests. All right, so it's very essential you do. Please, John Smith, you're using a very bad word. It's wrong. It's wrong. All right. Okay, I'll be lecturing us on pregnancy. Okay. Please, let's use right words here. Let's use right words here. Okay. It's very important. Okay, so pregnancy is a period of conception. Pregnancy is a period of conception. All right. So when you are pregnant, you don't say, just I'm going to have a baby very soon. No, you just talk like that. You talk like this. It's a period of conception whereby you are already having a fetus or a fetus forming in your womb. Okay, so let me share this slide that more persons can join. I just want to share the lives and more persons can join. So a period of conception, and it takes 3 trimesters. We have the first trimester, which is the first 1 to 3 months. We have the second trimester, which is the 4th to 6 months. Then we have the third trimester, which is the 7th to 9 months. Don't mind me. All right, so this period of conception, a lot happens during this period of conception. And why I'm talking about it, because some persons might have challenge in coping with some health conditions that might occur during this period of pregnancy. All right, we have some health challenges that might occur that you can manage. All right, one common one, especially in the first trimester, is when you have this nausea, or you're feeling like you want to vomit. It happens. Some women don't experience this, some don't, some do. All right, some do at the beginning of the pregnancy, which is the first trimester, and later it doesn't proceed, it stops. Okay, so most of the times it's advisable you know what to do at that point in time. All right, so when you're experiencing NSA, you can just get a gum to suppress it, or you can take ginger tea. It will help you to reduce the NSA. that you feel. All right, and if you're the type that vomits during pregnancy, ensure that you don't take food that will trigger you vomiting. Okay, you have to avoid it. Any food that will make you feel like you want to vomit, you try as much as possible to avoid it. All right, and during pregnancy, someone can also experience a sore in the left breast. You can also experience heartburn, which is known as acid reflux. It can happen. You start feeling this pain. You start feeling this pain that you cannot explain, like you have an ulcer condition. So it's like that. That's reflex, the acid reflex, and you can be advised to take calcium and antacid. All right, because it will help to reduce the reflex you feel, the acid reflex you feel. All right, I also have some other conditions that might happen when you're pregnant. You can feel sometimes dizzy. Some person can feel dizzy sometimes when pregnant. Some persons can feel weak while pregnant. Some person can have all manner of symptoms while pregnant. So some people tell you, when I'm pregnant, there are some special food that I take. There are some I don't need to take. Well, I'll tell you, just eat good food during pregnancy. Eat good food, okay? Eat good fruits. Ensure your food and your fruits, they are thoroughly washed before preparation, because your body is prone to some diseases when you are pregnant. Like I had a case of a woman that came to the clinic a time like that, and she was like, I don't have malaria, I don't have typhoid. They said it's common with pregnant women. It's true. At the first trimester, it's very common. So my experience is also in second trimester. It's common. And there was a patient I also had that I attended to that was having this vomiting, and she was also feeling weak, having some headaches, and all of that. I gave her just amoxicillin since she was having fever, because we ran some tests for her and she was having typhoid. All right, so that was the drugs I gave to her. For the vomiting, I gave her avomine, and she was very happy. With time, everything was able to work out better. All right, she has given birth already. I think the baby should be on like 6 months or more. All right, so when you're pregnant, you should always seek medical advice, seek medical attention. It's very important to seek medical attention while you're pregnant, so that you will not go and do things you should not do. And also, we have a disease condition that is prone to some pregnant women, like gestational diabetes. It occurs during pregnancy, and it can affect the baby, all right, in the womb. And most times, when a woman have that gestational diabetes, the baby can be affected, and that baby will have jaundice occurring. The baby might even feel blood, or rather have loud vision, and so many other health conditions can be channeled to it. So overweight of the baby can, or low weight gain, so many other conditions can occur. So it's advisable that when you're pregnant, you should know what to do, what not to do, what to take, what not to take. Okay, and some drugs too. If you are having, if you are the pregnant woman and you're having malaria, don't just go to the chemist and get malaria drugs. All right, don't just go to the chemist and get malaria drugs. Ensure you seek medical attention. All right, according to what I put to note here, I said to note here. I said in pregnancy, women experience a lot of things. All right, in my note, I said pregnancy is a period of conception, which I've earlier said, and I mentioned some of the health conditions that occur due to pregnancy. And I also made mention of acid reflux, which is common among pregnant women. Hi, Titi, you're welcome. And this acid reflux occurs when the stomach acid flows back to into the esophagus, causing a burning sensation. All right. So when that acid in the stomach, remember we have hydrochloric acid. Every human have hydrochloric acid in the stomach. So when that stomach flows to the esophagus, it causes acid reflux to occur. And during pregnancy, it occurs. It's very common during pregnancy. You see your heart burn so hot, and sometimes or most times you experience what we call a pain, a very tender pain or severe pain in your left breast. And I also said ways to manage this acid reflux. One way to manage acid reflux is for you to take antacid alongside with calcium. So it will help you to manage the acid reflux. And thank you for loving my life. Thank you. So it will help you to manage it. All right. And you don't just go and take it except a doctor asks you to. Because there are some persons that are pregnant, they might have some health conditions. And there are some drugs that might want to work for that other health condition, but because of their states or maybe they have other health issues, they won't be advised to take it. All right, I also said sore breasts, which I've earlier mentioned. So one of the disease conditions that occur is acid reflux. We also have sore breasts, which I've earlier said. It happens during pregnancy. You start feeling pain in your left breast. So it happens during pregnancy. Not that it's one severe thing you should be worried about. It's just something that's common during pregnancy. And I also wrote here, I said ways to manage it. You have to use a cold press. A cold press will help you to manage the acid reflux in your chest. All right. And for your breast, you shouldn't wear something that will be too tight. Make sure you wear clothes that are loosening up a bit. Okay, they should be loosening up. You shouldn't be stiff to your chest. And if you're at home, you can decide not to wear the what they call it, the breast tube or the bra, whatever you want to wear. Because of the, you may decide not to wear it. Just be like that. Just free yourself. Ensure during pregnancy you don't wear a tight fitted bra to hold your breast, because you might be having pains often because of the pregnancy. And one way is to manage this sore breast, like I said, a warm bath. Okay, I'm just saying that now. A warm bath is also needed. Right, you can have a warm bath. Just be yourself. Okay, and one other local way I'll mention is you can use a shea butter just to rub your chest, but it's just for some time. It will not really reduce the pains, but what will really work for you is cold compress sore for your chest when you feel that way, and taking of that antacid and calcium. All right, I said earlier that some other health condition that can happen to you when you're pregnant, NESA, feeling of vomiting, or vomiting itself. So I told us that we should avoid anything that will trigger you vomiting, the food you take, the fruits. So because that period when you're pregnant, you are allergic to so many things. A lot of women are allergic to so many things when they are pregnant. So just know what you're allergic to and don't take it during that pregnancy. Okay, and how to manage this is by eating food that has low fats, and also ginger tea can also help. All right, to manage this condition, and food that have high carbohydrates can also help to manage the NESA or vomiting that you feel or you're having. All right, I also said the way to avoid you vomiting, that you should try as much as possible to identify food that has smell. I personally, I have some meal that can trigger me vomiting, whether pregnant or not. There are other persons that feel that same way. There's some food you cannot take. There's some fruits you cannot eat because you have allergic to it. So during pregnancy, don't have a craving for those food. All right, don't crave for those food that you don't normally eat. But women are funny sometimes, but I know it's not really their fault because of the health condition or because of the pregnancy. So they can crave for anything, even at the middle of the night. It's very common with them. So I also said avoid overfeeding during pregnancy. I know that during pregnancy you want to eat heaven and earth. Sorry to say, you want to eat everything that is eatable, but you just have to avoid overfeeding yourself. Overfeeding yourself is not the best for you. You can easily throw up. So don't just carry food and be eating because you want to eat, because you are pregnant, you feel like eating. You have to be sure if the food will be good for you or not. All right. And I also said, yeah, you can take gum when you feel like nausea, you had this nausea, or you feel like vomit, you can just chew some gum. It can also help, depend on you. So women only experience it at the early stage of their pregnancy. Before they get to second trimester, it stops. Why some throughout their pregnancy, you see them throwing saliva because of excessive secretion of salivary gland. They will experience that time. So women do that a lot. Why some they don't feel that way. Like the woman I was talking about that never fall sick of malaria or typhoid. And we find out that our environment was very nice. Our environment is free from mosquitoes because she liked fumigating the environment and staying off dirty environment. She keep good personal hygiene, and she gave birth to a healthy baby. Most times what you eat and what you take can help you on how your baby will look like. All right, in the sense, I'm not talking about beauty, I'm talking about the skin of the baby. I've seen a baby that was delivered, and what happened, the skin color was obvious that there was some defects, so having some scars in the skin. And I find out that as a result, that was as a result of the nutrient depreciation or nutrient deficiency. All right, so called that nutrient deficiency, she tends not to have a healthy baby. So what you eat matters when you're pregnant. Even if you are craving for a lot of things, know the right thing to eat. All right, so I already said that you're prone to malaria when you're pregnant, prone to malaria. All right, and sometimes the persons at the first stage, the first trimester, the first 3 months, the persons can be prone to malaria from that first 3 months, second 3 months, the third 3 months, till they give it to that child. Why some it doesn't happen that way. So it depends on you. All right, individual differs. We are unique in our own way. So when you have this, try to visit a medical personnel, all right, to know the exact drugs to take so that you won't cause harm for yourself. And some person during pregnancy, they also experience headaches and sometimes can be migraine. So that's why during that pregnancy stage, you try and avoid stress. Sleep well. I said avoid stress, avoid sleeplessness. All right, take pain relief like PCM, which is paracetamol, or any acetaminophen tablets for the pains. And make sure those drugs are strictly prescribed by the doctor. The drugs you take during pregnancy. Don't abuse drugs because it can affect the fetus or the fetus. All right, and I said what to eat while pregnant. When pregnant, what you eat is that you eat good fruit. I can't tell you, okay, eat apple, eat pineapple, or eat guava, or eat oranges. No, just eat good fruits. All right, fruit of good nutrients, fruits that will give you healthy nutrients, not fruits that are not well washed, not fruits that have some scar, or fruits that have some infections on it, or fruits that we have one bug at one side. You have to use a knife to cut the bug side off and eat it. It's not healthy. It's not healthy, all right? So you have to eat good fruit, fruits that is neat, fruits that is healthy. Okay? Also, I also said avoid eating late. Okay, when you're pregnant, please, I know you crave for a lot of things at the middle of the night. It can affect you. It can also affect you eating late when pregnant. It's not really advisable. It's good you eat on time. All right? Don't crave for what is not craveable or what cannot be given to you at the middle of the night. Try to eat on time when pregnant, and don't. I also say eat more vegetables because it will help to build your blood and boost your immune system. So it will help to build your blood and boost your immune system while pregnant. It's very important. So when that happens, you will be able to stay healthy during your pregnancy period. But by the time you don't eat well, or you eat food that are less of balanced nutrients, at the end of the day, what happened to you? It will affect your baby too. You start having some health issues, and your baby will also have the same. All right. I wrote here, I said avoid eating unwashed food before preparation or unwashed fruits. This can trigger other health disease conditions. And I also said avoid eating food with excess fats. This can trigger heart conditions too. Yes, food of excess fats. When you consume food that have excess fat, it can cause disease condition, cardiac disease conditions, or heart disease conditions. And I also said one other disease condition that occurs during pregnancy is gestational diabetes, which is common among pregnant women. Right? These affect the baby, and I've said it earlier on. It causes jaundice, it causes pale vision or pale vision for the baby. All right, and so many other health conditions can happen. So when you are pregnant, I'm advising you avoid meals that contain excess fat. What you should eat is food that contain low fat, high carbohydrates, other balanced diet food, so that your health will be stable. And you can also experience hypertension due to this health condition, all right, or heart disease condition or cardiac disease conditions. It's common with some women during their pregnancy. You see them experiencing being hypertensive. Sometimes it might be genetic, all right, it might be like someone in the family have had such an experience before. So it's advisable when you know that, you try to avoid stress or anything that will trigger you having some heart condition, like eating of excess cholesterol food or high fat food. And I also said overgrowth of the baby can occur when you consume excess fat food. All right, the baby can be overgrown, and the doctor will tell you, or the matron will tell you, it is right now, we cannot do normal delivery for you because your baby is 4 point something kg, maybe it's almost 5 kg because of the food you consume. So for you to avoid CS experience, try to eat food that is a balanced diet and not the one that will cause your baby to overgrow, and you now have to have a surgical procedure to bring your baby out. All right, thank you very much for listening to my live. Though I didn't really have much viewers, but I believe after now we'll learn a lot from this live section. God bless you all. Do we have any question? Titi, any question? Do we have questions to ask? Any question on pregnancy and some disease condition that occurs? Do we have questions to ask? All right. In the absence of no question, I'll tell us to have a wonderful night. Thank you very much for listening to my life.